All right. I've been given a task of speaking about current challenges in surgical training. My name is Prof. Farooq Afzal, and I'm president of the Society of Surgeons Lahore chapter. Thank you for the invitation here. All right, so the objective is to highlight the current challenges affecting the postgraduate surgical training and to discuss some of the solutions. As you all know, that the goal of postgraduate surgical training is to produce surgeons who are safe for the society. But the greatest challenge is that there is a direct relationship between patient safety and these residents' autonomy. So if you are training them and the training is too liberal, there are high chances of patients' harm. And if it's too tight, there are future risks of patients' harm. So you have to strike a balance between patients' safety and residents' training. So these days, there are a lot of discussion about whether surgical training is of good quality or not. So I did a recent survey with my postgraduate training, and I found that not all of them were satisfied with their training, and they think that they would not be able to do independent practice after that. And it's not with me only. It's with the US graduates as well. About 1/4 of US graduates don't feel confident enough for independent practice. And surprisingly, this is a fellowship program survey in US that they found that 30% could not perform independent lab colleagues. So there's a huge issue. And why is this happening? Because over a period of time, the surgical training has changed because there are a large number of surgical residents, there are less training slots. So they're not getting the proper case volume, and that's why they have to seek additional fellowship trainings. So what are the current challenges in our setup? So what I found is there are problems with the input, problem with process, and the problem with outcome. So input, there is no interview, so the selection is based on numbers, and there is no qualitative assessment. The second is the process problem. I think the biggest is the standardization of training. So not only the trainees are not up to the mark, less skillful, more knowledgeable, but they have lack of professionalism and political activism, and lastly, the female numbers. So because of that, there's a huge issues of training. And not only that, trainers are also not well equipped with the modern surgical techniques, especially the advanced laparoscopic skills and robotic skills. And that's why the people are not getting uniform laparoscopic exposure as well as robotic exposure. And lastly, about the training curriculum, there is a lack of standardized training. There's more emphasis on apprenticeship and time-based rather than competence-based training. And that's the reason the outcome is of poor quality. So what are the different solutions? I think the best is to have a better selection process, whatever MD care or whatever process, they have to involve the interview and they have to involve the trainers. Secondly, I think the solution is adopting modern competency-based training models and then enhancing the skills of both the trainees and the trainers by using the simulation. And I think not only they need training in simulation, but they also need training in leadership and teamwork. And lastly, accountability of both the trainees and trainers should be there. And this is the pyramid, which will facilitate trainee autonomy, to starting with a competency-based curriculum, to simulation, to self-directed learning, because they are self-directed lifelong learners. Now, we know that simulation can bridge the gap and it shortens the learning curve, improves the operative efficiency, and more importantly, it improves the patient's safety. Now, despite of the fact there are still challenges to overcome, and that the first one is a political will. Then who is going to bring this huge volume of change? Because you need to design and update curriculum. For that, you need the capacity building of the faculty. And unfortunately, the regulatory bodies are also not working. So my summary is that the quality of post-surgical PG surgical training has hampered over a period of time, but it can be improved by better selection process of the surgical trainees, designing and adopting the EPAs, or a competency-based structural training program in which the focus is on mastery. We also need to train the trainers, and I think not only the pedagogical skill, but I think simulations can be used to train the trainers in advanced laparoscopic and robotic surgical training. I think the key is simulation. We need to build up more simulation centers so as to improve the patient safety, but at the same time, increasing the trainees' proficiency. And lastly, we need better assessment at workplace as well as summit. I thank you very much for your patience listening.